Hi class, today we're going to be talking about the foot cross-section model, which contains soft tissues, our bony structures, and the arcs of the foot. First, we'll talk about the different parts of the model. So one, we're going to see our leg bone. This bone specifically is going to be our tibia or our shin bone. We have our talus, our scaphoid bone, our cuneiform bone, our metatarsals, our proximal phalanx, and then our distal phalanx. We also see here in the light blue articular cartilage. In red we see our muscles, and then we also see ligaments and tendons up the base of the foot as well. Our superficial layer is going to contain fat and our skin as well. Our feet and ankles bones help hold in place our ankle, and they're supported by various soft tissues, cartilage, ligaments, muscles, and bursae. The cartilage, which we'll see in the base of the foot and between our bones, which are the articulation for our joints. These are flexible, shiny, smooth tissues that we see at the end of our bones, and they all meet to form joints. There are many joints in the bone or in the foot model because between each joint we're going to have specific, between each bone, we're going to have specific joints. A few of them are the TC or the talocrural joint, the subtalar joint, the mid-tarsal joint, the TMT joint or the tarso-metatarsal joint, and the interphalangeal joints, which we'll see between our phalanges. The arcs of the foot are formed by the tarsal and the metatarsal bones. They're strengthened by ligaments and tendons, which we see below the bones, and they allow the foot to support the weight of the body in erect posture with the least weight. The function of the arcs of the foot is to support for shock absorption, propulsion, and weight bearing. There are 3 specific arcs in the foot. We have our medial longitudinal, we have our lateral longitudinal, and our transverse arc. For specific purposes, it's important to remember that the fibula is our non-weight bearing bone and our tibia is our weight bearing bone, or the shin bone, which we see here. The foot itself is housed in 2 different regions. The calcaneal region encompasses the heel, and the plantar region here encompasses the sole of the foot. The muscles contained in the deep compartment of the plantar foot here are divided between the superficial region by an intermuscular septum. In order of anterior to posterior, the muscles traveling into the plantar foot are referred to as the tarsal tunnel muscles. They include the tibialis posterior, the flexor digitorum longus, and the posterior tibial artery and vein, which we see here, and the tibial nerve, which we see in yellow. They can easily be remembered using Tom, Dick, and Harry. And then we also have our flexor hallucis longus, which is the last muscle of the tarsal tunnel. The anatomical neighbors of the foot are the proximal fibula and tibia, which remember are the shin and calf bones. The muscles of the superficial compartment are also anatomical neighbors. This compartment can be referred to as the scroll region, which we don't see here, but it would be the back of the leg. Its muscles are the gastrocnemius, the soleus, the plantaris, and their function is to plantar flex the ankle and our toes. And that concludes our video on the foot cross-section model.